right on this day. It's Tuesday, October 6th, and we are taping live for Zoom at the moment because Ecamm Live, the interview mode of Ecamm Live, is still on beta, meaning there's a lot of glitches. So I will rather be using the Zoom platform and software for this interesting day that I'm going to have with Dr. Agnes Bueno. She's a doctor of psychiatry for 40 years. And it's very interesting. This is our third episode, but we can never get enough of the knowledge or the wisdom that probably a lot of people have swept under the rug, especially because we never really discuss the female anatomy. And I think it's very interesting that Dr. Agnes Bueno will be sharing her insights about the female anatomy and her vagina. So I know it is a very strong word to talk about, but we would like to inform the people who just tuned in or watching this program by chance that if there are kids around, uh, please don't let them join you with this publishing, with this broadcast. These are for people who want to explore and get more education about the female anatomy. Good
Well, as
afternoon.
long
Good,
as
yeah,
as
good
long as their
morning.
parents are with them, the kids can join.
Oh, there you go. There you
And that's
go.
when it's such a thing as parental guidance.
Yeah, so this is on parental guidance. Thank you very much, Dr. Agnes Bueno. We're having intimate conversations with her, and we will be publishing this today. How are you today? What's going on?
I was I was busy looking for an earring that would fit my outfit. So I
Ayun na
look
nga eh,
okay.
because sabi ni Dr. We were supposed to start a little bit earlier, but she was going through a lot of she said she was distressed, and I said, "What's the distress all about?" And then she said as simple as finding the right earrings for her outfit could distress her. Normal ba yun?
Well, that is the female in me, all right.
Oo.
Although, okay, I'm sorry, I interrupted
No,
you.
no, no, no. It's just very interesting because as we go through this, I think we love the idea that we can bring something to the audience once a week, and Tuesday seems to be our favorite day. So I think this will be our structure. Um, Going back to the first two episodes that we had talked about, I think we were exploring the female anatomy in episode one and two, and some
Yeah, the
people
female sexuality,
female,
and
yeah,
we
sexuality and
didn't
anatomy.
touch on the anatomy of the female sexual organ.
Oh, yung sexual organ. Sorry if yes, I couldn't define if we can use vajayjay or vagina or a
See, that's
clinical.
that's the thing. See, you have to put another name like JJ. It's that it's intrinsic in our collective psyche. To be ashamed of the female's
Organ.
sexuality. You
Oo,
you know
oo.
it tends to be uh, made invisible. That's why eventually, Jake,
Oh.
you're going to become, after your stint with me, you're going to become a sex guru.
Uh,
Yes, because you
well,
are you are so ambidextrous. You can, I guess, because you're an excellent actor,
no,
you
I'm
can
just very curious because
come with the flow.
yeah, go with the flow, and I think there's a lot of like I think we are very. I think even at my age at 54, I'm very uninformed, and having the conversation of this with you is always very informative. So let's explore what and maybe do a recap on what we talked about the sexual organ of the female. Um, Yes, there is such shame, not shame, but nahirapan ako to define or to even to give a word for it because you don't want to be too clinical and you don't want to be too crass. What is the correct term anyway?
It should be vulva, not vagina, because the vagina is just a space. It's a space. It's not the real sexual organ of the female. So instead of saying vagina, it sounds better than vajayjay.
Hindi, ginaya ko lang si Oprah Winfrey kasi vajayjay tawag.
So it should be vulva because actually the vagina is not an organ, it's just a space. So I guess evolutionarily, the female was tricked into being super sexual so that she can allow the man to impregnate her. See, that's nature, tricking the female, because it's one of the things that the educators fail to mention is that the side effect of sexual intercourse is pregnancy. All right, under normal situations. So if the girls are not, or the boys for that matter, are not made aware of this, that if you have sex, possibly you're going to be impregnated, right? That's nature at work. So it's not a light matter to not talk about these matters when you're still young, because you are still not without the hormones. So it's better to absorb it without the testosterone or the hormones of the female, estrogen, etc. To it's some kind of programming. Of course, I'm always controversial because I speak the truth. All right, it's better really to teach when the hormones are not yet there. See, because then they will not respond in a different way because the hormones are getting in the way, right? Like for example, the custom of arranging marriages, the kids that are being um, promised by the parents are already programmed to like and sort of love that boy who's been promised to her. So she's already programmed for that. That's why it works for them, but
Mhm.
not in the Western world, of course, because the programming is different. Okay,
Yeah.
so even in the Western world, you'll be amazed. They don't know what I'm talking about right now. So even doctors don't know what I talk about, and it's a serious matter actually. And I don't understand why every time you talk about sex, people say it in jokes. The men, for example, they say it in jokes, and what really amazes me is that the females laugh with it when actually most of those jokes are derogatory to women, as a matter of fact. So, uh, okay. So what were we talking about? I got a little, I am so full of it that
I know.
you need to
No.
you need
No.
to direct me. You're
Yes,
the
yes, yes.
actor.
No, no,
You're
no.
the
I'm listening to you intently. I think just for the what my takeaway was that you said that you compared the there's a in the East there is such a I think not only in the
yeah,
East there,
yes.
I think the there's some countries, especially in the Middle East, are also has that tradition where the parents look for a predestined marriage,
It's
fixed
prearranged.
prearranged marriage.
Prearranged.
Yeah, yeah, yeah.
And when the kids are still
Yeah, and
young.
then you said that in the West that this is a new concept, but maybe there's no label, but maybe because of I think what I'm trying to understand here is that maybe because of familiarity, or I think that's how it started really. Because if you live in a village, in a small village, and you know each other very well, you only procreate within the community. So I think that's why you can say, oh, this is a prearranged marriage. So I think that's how it probably developed. I'm not so
and and,
sure.
and and the kids, the promised kids, are already programmed to think in a manner that this little boy or this girl is going to be their husband or their wife. See,
So I
so
think
they're already programmed to like the guy or the girl. See,
so. Yeah, what you touched on though is that you said that it's a good advice. So is it better because you teach the parents will teach you about, or your culture will teach you about getting into the marriage, procreation, copulation. So is
well,
this
in the East, it's just basically an arrangement. They don't go into the sexual part of it, of course. So it's up for the two
I
to
think
find themselves
I
within.
think I've seen, well, this is like very basic, no, but I've seen it in movies that uh, when I saw Yentl of Barbara Streisand, and then I think that was the film, yes, and a couple of other films too. I think with the because in their, I think they were Hebrew or Jewish, but before the marriage, they also the bride wears a blanket with a hole,
Hmm.
right? And this is where they're going to to copulate. So
Hmm.
I guess somebody teaches them that there will be a hole, so the blanket will absorb the flow of the blood if she's a virgin when the hymen is broken. So there is education to the
Yes, as I was saying in the previous series of our conversation, that it's sex education starts from birth. Okay,
I
so
see.
let's go to the female anatomy.
Okay.
I think I was saying something like, uh, I don't know who's responsible for it. I guess society has made it invisible. So they always, everybody refers to it as vagina, not the vulva. Okay,
Teka,
that
bigyan mo,
is that
maybe
is the
okay.
real
I think
sexual organ of the female.
okay. So in my mind also, let me just see it so I have a picture of it. So you have the vagina as the opening, and then you have the
On
clitoris.
on top of it is the clitoris,
Clitoris, correct.
but it looks very similar to the male organ. So if you imagine the male organ, it's almost a minuscule version of the phallus. Okay, but it's hidden. It's
Mm.
hidden. You
Mm-hmm,
don't see it. And
mm-hmm.
sometimes, when I scroll through Facebook, uh, the girls, and there are groups wherein the girls express something like, the guy can never find her clitoris. So it's really some kind of, I don't know. It's almost like it's intentional to hide the female organ.
Baka it's designed that way.
Yeah, because yes, yes. If you come to think about it, if you live long enough, at up to 80, if you're a woman, you can only really desire about five males at the maximum. If you go beyond that, then it can almost be like a scale that there's something the matter with you, and so you should come to someone like me, a therapist. Okay.
Yeah, but I'm also saying that the female organ is designed, or the vulva is designed so that not a lot, because it's a very mysterious organ and it doesn't need to be exposed. Baka ganun yun. Tama ba yun?
Oo, kasi nga, I think that's nature at work eh. Kasi hindi naman po, it's not good naturally to have a lot of men enter your body. See? So for a man, it's okay because he enters another woman outside of the home. The original concept of being a family unit is precisely that. In the old days, wala pa noong DNA test, So
Mm-mm.
they have to really assure that the kids are the man's kids. But nowadays, come on, you need DNA all the time because you never know if the woman has been sleeping with another guy, right? I mean, before you even before you even get married, my guys, you have to know that you really cannot really sleep anymore with another guy, isn't it?
No,
So these
that's also
things that
something that's very psychological na nangyayari din doon eh. Yun na nga din because we don't wish to judge anybody's perception of this, or if they have any conviction with what we're talking about regarding several partners. But that's, I think, what Doctora was saying here too, is that when you there's something that happens when you do when you're is that what you're saying? If you're polygamous,
no,
if you're having more
eh,
partners, then there's
no, no,
us.
no, no.
Okay.
Because you have to have that component of desire that I was talking about in our first session. Okay,
Okay. Okay.
you have to have that. So if you have multiple men, or if you are a sex worker, for example, I don't like that. I don't like that term.
Hmm.
It's better to say just prostitute. It's better that way.
Yeah.
Because if you say sex worker, I don't know, something happens to my mind that I cannot accept it.
Mm-mm-mm-mm.
Anyway, so what were we talking about?
Yeah, so hindi. But hindi nga. So,
You pulled towards, or am
but
I getting demented?
no, no. Pinag-uusapan natin kasi yung kanyang ano, 'di ba nga, yung vulva. And I think we also explored the idea that um you were saying kasi that a woman could probably have several would desire. I think it's human nature in general. We have desires.
Human nature.
Yeah,
If
we
you were to live long enough,
oo,
you can
tama.
only have a maximum of about 5 men
Yeah, and
to
also
have desired. Unless you're of course restricted by marriage, because then
restricted of marriage, or you if
with
you
or
have
without
oh,
marriage.
tsaka choice din yan ng mga morals ng tao, 'di ba? I mean, because some people really adhere to monogamy and some people adhere to polygamy. And we can't say what's wrong. I can't pinpoint. I don't want to be pointing fingers and saying this prefers. I prefer this, and then I prefer that, or because we don't. There's too many points of view for that with that discussion, right? Ikaw, ano bang point of view mo dyan?
Kasi culturally, talagang anthropologically, you have to develop a culture. So if someone confronts you that does not believe in your belief system, you take up arms and you have to protect your own belief system. Otherwise, you you fail to exist within a certain culture. Okay, so what was I saying? I always get distracted because we are actually talking about the true sexual organ of the female.
Let's get back to
So
that. I mean, yeah, but
yes,
I think we've
what I
discussed.
was saying earlier, kasi na-distract tayo. Kasi
Mm-mm.
syempre, ikaw din, maraming pumapasok sa isip mo as you talk about it. Kasi free-flowing tayo, di ba?
Yeah, and
Hindi siya prepared
I love that
lecture,
about.
or
I love
it's,
that.
I'm done with that. I'm bored with that. So it is a better form of education also, is to talk about it. And perhaps when somebody listens to us, it's more, it's better than listening to a lecture. Okay.
Correct.
So
Yeah, yeah.
if you bring me back to the sexual organ, the true sexual organ of the female is the vulva. The vagina is an airspace. It's like if you buy a condominium, you just buy the airspace. You're not buying a house. You're buying the airspace occupied by that room. So you're buying air, right?
I see. Oh, maganda yung
Yes.
ano mo,
You know why I
analogy
get
mo.
distracted? Kasi
Oo.
ang dami-dami talagang pumapasok na, emanations of even talking about the vulva, which since time immemorial has been made invisible, right?
Oo.
So
Baka,
lahat ng tao, katulad ng men, tina-target yung vagina, tina-target nila, hindi naman yon. So nature tricks nga the female by making her so sexual para pumayag siya na i-penetrate yung area na yon na wala namang nerve endings. Come on, nagfe-fake lang yung babae na yan. If every time you penetrate her, she goes into some kind of orgasmic, uh, epileptic something, she's
wait, wait, wait,
faking
wait.
it. She's
Sorry.
faking it, all right?
No, wait.
It's not real.
Let me clear that. But
Oh,
I think that's why, correct me if I'm wrong, but there were two ways to have an orgasm for a woman. One is clitoral, and one is the so nobody gets orgasm with penetration.
it's very seldom because there are no nerve endings there.
No, but there is
They're
such a
missing
thing.
the.
Yeah, but there is such a thing as a G spot if you know what it is.
Well, that's only by Dr. Grafenberg because he's an obstetrician and he happened to accidentally poke at a certain part of the female's vulva, not knowing that the female siguro has a vulva. So, tinawag niya na Grafenberg spot. And everybody thought that G spot is just consistent, the same for
For
everybody.
everybody. Yeah, it's
Yes.
different
So
for
so if
everybody.
so if the man keeps targeting the clitoris, it can be painful because that's full of nerve endings.
Correct.
So he has to, at least the woman has to teach him where that spot is. But if it's the woman herself who's ignorant, hindi rin niya alam. So she expects the guy to know it. Eh, my gosh, so they will be fumbling about until, the woman gets pregnant and never, as I was saying in our first conversation, never really experiences pleasure because both of them don't know where it is. O, di ba?
It's kind
So,
of interesting. I think that's why.
to make it lighter, I had this old, very rich man
Naku,
who.
ayan na, nagtapat na.
No, 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 no. Uh,
Parang,
Teka, nawawala ako sa
ano ba to?
topic.
True
No, no, no,
confession
no,
ba?
no, no. What
True,
I'm saying is
true
there
confession
was
but
there there was this very rich guy, multi-millionaire. I don't want to mention his name.
Oo. So may
Who
tanong
would
muna ako bago ka
no no
magkwento.
no? Who would say to anyone or any of his kids marrying to come to me first? So if he says to the daughter, "Oh, you bring your boyfriend to Dr. Bueno para kung okay sa kanya, sige, you're free to get married." See? So, uh, it's so that is a sophisticated rich man. So mayaman na marunong, 'di ba? Right? So teka, na-distract na naman ako.
No,
What
no,
were
no,
we
no.
talking?
No, you were saying, so, teka, ang punto nun is that he's sophisticated because he believes in science.
No, he used to see me
Oh, psychiatrist.
himself. He
Okay.
used to see me himself. Oh, baka tumawa ka na naman
Hindi,
kasi
okay. And then,
maraming older men, na powerful men who have wanted me. So, tago na lang ako ng tago parati kaya naging reclusive ako ang lifestyle ko. See? So ito, he used to see me and maybe he really sees me as someone who is the proper person to go to about certain matters, no? Kasi he used to consult me about himself. And of course, if you're a rich man, you have a lot of women, right? You can afford it. So Um,
Oh
where
yeah,
were we?
well, I don't know. I don't know if I like.
Oh my
No,
goodness.
pero I think you were saying that because the rich guy trusts you, so the advice that you may give his daughters regarding the time to get married is has value.
And to assess the
Yeah,
future
assess.
son-in-law
Oh,
if
oh,
he is not a weirdo or something like that because he has a lot of money. You know,
oh,
he's just ensuring that his money gets preserved and not going to be uh, uh, thrown away by some stranger to him.
okay.
So,
So anyway, so yun pa rin yung pinag-uusapan natin, no? I mean,
oh, kasama na siguro din yon yung sex education na
Oo.
off tangent. See, kasi he probably knows that I will be very thorough in assessing.
Yeah. Okay. So yes, going
So
back to
that's a
the
luxury. It's a luxury
going back to
to
the
come to me.
yeah, going back to the letter vulva. So
Yeah, it's the vulva. So para i-ano sa mind ng makikinig tsaka ikaw din, you know.
yeah, yeah, yeah.
para
So
para you know also.
anything else with so there's such a thing as a G spot, there's a vulva, there's a clitoris,
Yes.
and then there
The
is
G spot, by the way, the G spot is just one spot.
and
The
it
female is full of spots. The
okay,
female is
so
full of spots. It
that
can be
diff
her big toe. It can be her neck. You know, that's why halos black and blue na yung neck na yan kasi it's really, it can make you go into orgasm.
yeah,
Even if
erogenous
you
zone.
don't, it's not really the vagina. Come on, guys and girls. Ah, so if
Yeah, 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 yeah.
yeah, that's
So
what I
I
find
think
out.
I
If
think we have no erogenous zones in our body because we're
yes,
so may
yes,
mga ganon.
yes,
Yeah, 'di ba?
right.
Ang tawag doon. So and I think what I've learned too is that there are several G spots. So that's that communication is very important, especially if you have an intimate relationship with somebody. You
Maybe
can
it should not
actually
be G spot. It should probably be Bueno spot or Amnesita spot. Kasi si Grafenberg, you know, yung isang spot lang na yun eh.
oh, okay, sigo. Erogenous zone na lang. Mas
Oo,
maganda. Oo.
erogenous zone, hindi, or erogenous spot. You know,
Yes.
it's more specific, 'di
Yes.
ba?
Yeah, that's
So,
true.
so when in my clinic, you know, women come to me because of frigidity, etc., etc. So I show her diagrams, you know, of the vulva, and most of my patients really don't know
So
where it is.
so wait a minute. Is it do you advise that women should actually use a mirror to see and explore their
It's very
organ?
difficult. It's not anatomically, you know, she won't be able to see it herself.
No, so kailangan yung mirror mo malaki tapos
Eh,
doon ka
hindi mo
titingin.
makikita kasi tip of the iceberg lang yung vulva eh.
Ah, I see.
Okay?
But
See?
some
So,
people have tried, and I think some people were successful.
well, to try to feel it, not to see it.
Mm, okay.
That's why it's more, you know, instead of calling it masturbatory behavior, it's really, to me, it's exploration. It's explorative.
Exploratory.
Kasi yung word na masturbation is attached to something that's bad, that's you know, sinful, etc., etc. But you know, when I say it's really self-exploration, it's not attached to anything else. Okay, so you
Yeah.
don't develop a lot of neurosis, meaning kung anong papasok sa mind
Oo
mo.
nga. Yun na nga ang problema dyan din kasi basta these things are, I think it's a good advice that, you know, we should be mindful of how we treat our body and how we explore our body. I think it's important that we know and understand our needs it's important that we communicate to our partners or intimate, or our partners, husbands and wives, what we need. It's exciting that even if you, I think, with if you have a steady partner or a lifetime partner, that you actually, could be a playground between you and between the two of you, because you know each other so well, and exploration will always be exciting with somebody that you love, isn't it?
Yes, but that's why it's called love play. It's it's really play. So it becomes routine. Oh my gosh, that's where it
Oo nga.
kills
Wag na wag, wag,
marriages, because
oo.
marriages, as you say, monogamous commitment na yun na lang forever in your life.
Yeah.
Well, it has to be stoked with a lot of matters to sustain it, to sustain the sexual tension. Because if it becomes routine, andyan na, maghahanap na yung mga partners or the woman
Yeah,
or
there is
guy.
something wrong
Kasi,
kasi yung word na
yeah,
monogamy, monotony, it sounds very boring. But actually, we should reclaim the word and make it more flowery, because there is such a thing with there's such beauty when you explore with your partner, when you discuss, and the discovery is actually boundless, di ba? Boundless yan eh, kasi meron kayong, dito naman tayo, you can also play roles. It's like,
that is why I don't understand. Do you know, Jake, where the practice of sleeping in one bed started?
no, saan naman
Maybe
yan?
if you go to the Bible, doon mo makikita siguro yung common practice na yan, that you have to be sleeping in the same bed. It's a turn off. My gosh, I don't know who, for me, sex play is almost like a production. You don't routinize it. It kills
Ah.
the, as I say, the desire. That's the first step towards love play. See?
Nakakatawa yung sinabi mo na yan. Kasi, syempre, kung
Oh,
matagal na kayo magkasama, di ba? Eh,
I
syempre, kung tapos
my
nag-start,
gosh ako, I don't want to be seeing the same face every day of my life.
hindi, may mga
You know,
taong gano'n.
I
Ang
need
mas,
my space.
ang mas nakakatakot, pagka kunyari 50 years na kayo magkasama or 30 years, tapos syempre, sometimes yung partner mo may sleep apnea, so meron pang respirator, di ba?
No
So,
way, hindi
no,
ba? Dapat,
hindi. I'm just saying that, there's a lot of things that you really, in a relationship, you really gotta find every single thing and accept that person that you promised to be with, because you have to find beauty in that. And also, of course, there's such a thing as people also snore at night, and then salivate and dream and snore. There's so
oh,
many.
even as you're talking about it, Jake, I'm getting turned off.
Yun na nga
See?
eh. Human
It's
ano
really,
yan. Human.
it's, oh
I
my
think there's
God.
two sides.
No,
No?
no, no. As I'm saying, whoever started that concept? Kasi with, well, of course, I can always use my own experience or the patients I've seen. Uh, it's, you cannot just, that's the problem eh, no? You sleep together and then sige, even in the Tagalog language, parang we have to invent new terminologies, because every time you refer to anything about sex, it it becomes a bit quote unquote bastos, di ba? So sometimes when I lecture on sex, I cannot use the Tagalog language. It automatically becomes bastos. So kailangan mag-invent pa ng mga terminologies ng Tagalog, kasi
Oo, oo nga.
pag
Well,
kami na ang pangit talagang pakinggan yung mga kasi na ano na sa ating psyche.
wala naman
uh,
kasing ang instruction at clinical term ng ating lengguwahe
Yun na
napakababaw pa
nga.
rin.
Diba? So
So
I
I,
have
I
to speak
and
English all the
I
time.
I must say though that also sharing a bed, there's some joy in it, because I've been sleeping with my partner for over 13 years, and the joy in it is actually yung lambing. I don't know,
Mm.
because this I can only talk to my experience. Like, when you wake up in the morning, you want to cuddle without 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 really going to sex, but really just cuddling and saying we're okay and
Yeah,
accepting
but that
that.
has to have some time limit. You
Well, we'll see. I'm
and
still.
sometimes the other one is not in the mood all the time for
Yes,
cuddling.
there's such a thing as wooing. There's such a thing as, meron niyang ganyan eh. Ano yan eh, parang makikita mo naman yan sa body chemistry. Yes, it may
No,
not.
I believe in individual sovereignty. That kind of, because attachment is never really good. That is the source of all kinds of very depressive things. So
I understand where you're coming from, but
dependency is
no.
terrible.
Wait. So yung ano lang yan, yung dependency is not searching the joy for the other person. That's not what I'm saying here. I'm just saying here that there is simple joy in wooing and lambing. So that happens when you share a bed as well. When does it last? I don't know. But there's some people who have shared beds and
Well, the
experience
only
that.
thing I like about Tagalog is that word, lambing. Kasi ako, malambing ako actually in my
Ganon?
nature. Parang,
Hindi. Malambing yan.
hindi, totoo. Pero pagka, syempre, nagiging, you go to university and be a professor, mahirap, or you're just negotiating uh, the streets. Pag malambing ka, hindi naman din applicable kasi I've discovered na halimbawa makikipag-usap ako sa mga karpintero, no? Not in a derogatory, any male for that matter. Pag malambing ako, iba na naman, napupunta na naman sa sex eh. Hindi ba nakakainis? Parang wala.
But that's not their problem. Ay, that's not
Yeah,
your problem. That's their problem.
yes,
Yeah,
pero
yeah.
nagiging problema mo din kung madami masyado na akala nilalambing mo sila. Eh teka muna, hindi kita gusto in that way. Come on. So
I, I,
women should
yeah, I
also
think
be.
it's also good that you have to, when you encounter those things, is also to, do not or avoid feeding that thought too, because that could be like a very mental thing to.
Karamihan, if I am my natural self, akala nag-flirt ako. Even in Tagalog, the word landi is a very derogatory
Oo nga.
terminology. When in fact, a female should be really alembong. I prefer the word alembong kasi sa landi. Kasi nadagdagan na ng hindi maganda yung word na yan. So, sasabihin, naku, ano ka ba? Bakit ka pa naglalandi dyan?
No, yeah. Ano yan eh?
believe that.
Generational yan, no? I think Landi came in right after, maybe after 60s or maybe lumabas yan ng 60s or 70s. Alembong was more on the pre-war and
Oo
post-war.
nga, nalalaman kong anong, that I am in that era.
Oo,
Hindi
so
ba,
yung
nakalimutan na yung word na alembong.
oo, kasi pelikula yan ni Lita Gutierrez? Is it Lita Gutierrez? I forget the actress now, but I know that was even like a
Yeah, she's
flop.
Ilocana. That's what I remember.
Maybe it's really a
Ilocana.
feature, a
Yeah.
whole feature of a film in
Yes,
the olden days.
yes.
But yeah, maybe we can discuss that, how Alembong became Landi. And we will get this translation right for you, for our American viewers. Paano ba yun? Sige, kasi that's a good discussion for our next episode, on the fourth episode.
Okay, so let's go back to the female.
No. We're running. we're on our. We're already running time. So I think what we could do is define first what you think is what is alembong, so that our American viewers they know what it is, and what is lande, and how that moved from
It
alembong
cannot,
to lande.
there is no direct translation, Jake.
Oo.
A Westerner would not be able to understand the that Filipino trait. So
It's a
it's so hard.
cultural it's a
There's no.
cultural nuance. Tama ba?
Yes, and of course, the closest is flirtatious, or she's flirting with me, or she's a flirt, but not in a derogatory way in the Western world, right?
So
Pero
there,
dito,
so
parang
maybe
ang sama-sama mong babae. It's like you
oh,
are the worst kind of, you're,
oh,
if I can use all the derogatory terminologies,
yeah. So maybe we can
you're the
simplify
worst
that.
kind.
Yeah. So we can
Yeah.
simplify that. I think alembong could be flirtatious, and then eventually there's a Tagalog word that came out after in the 60s and became malande, and malande is probably naughty, flirtatious. I don't know what it is, but naughtier, and it became
Mm.
a derogatory word. We can discuss this in our fourth episode. So let's wrap this conversation. I think we sort of like explored. We were able to at least have a picture, or you've painted a picture of the female organ, and I think it is quite simplistic, but we had explored several topics surrounding that. Forgive us if we had strayed away from the topic, but as you see, our form of conversation is very free flowing, and I think between Dr. Agnes and I, we are creating this brand that we don't want it too structured. We don't want it to that it's a lesson, and we don't want it to sound didactic. It's always having an intimate conversation with a good friend, and that is Doctor of Psychiatry, Dr. Agnes Bueno. Thank you for joining me
Mhm.
again, and thank you.
Okay.
You
See you.
are you are wearing all white, so the glow from your clothes. You're actually because of the extreme. It's high contrast because of the
I don't
dark back.
I don't get to see myself while I'm talking
Yeah,
to you.
you don't need to see yourself. You're beautiful, girl.
Oh, thank you.
Okay, Brigitte, would you like to say goodbye
Okay,
to
Elaine.
everybody and enjoy the rest of the week, everybody? And thank you again, Dr. Agnes Bueno.
No problem.
Any word of advice?
Well, what advice? Meaning, I don't give advices, Jay.
Yeah. No
No, I
advice.
told you
Yeah. So no,
I'm not a guidance counselor.
correct.
I'm not tita, tita.
Yeah.
I am Agnes Bueno, Dr. Wow,
Dr. Wow. So
a
thank you very much,
professor
ladies
of
and gentlemen.
psychiatry.
Correct. Thank you for
But at the
joining us.
same time, I'm just another girl, talking to another beautiful person. And that's
Oh,
me.
parang pelikula yun ni Julia Roberts. I'm
Ay,
I'm just a girl
tingnan mo.
standing in front of the
Ano
guy.
ba yung sabi niya?
I'm
I'm
just a
just what?
girl standing in front of a guy asking him to love me.
Diba? So, I like the hairstyle of Hugh Grant. Babagay yun sa iyo eh.
Yeah.
Yung ganyan,
Oo.
yung
Oo
medyo
nga.
mahaba-haba.
Oo nga. Pagka
Hindi niya
walang
hindi
gel,
niya
parang
nilalagyan ng gel kasi parang ano lang, ganun. I
bagay
like
lang
that.
yan sa UK. Pagka dito kasi buhaghag ang buhok. Di ba? Alam mo naman dito, pag mainit, pataas ang buhok.
Hindi,
Anyway,
maski anong buhok mo, ano ka pa rin, guwapo ka pa
yay!
rin.
Thanks, Dr. Agnes. I'll see you
Ito
next
na naman
episode.
tayo, the
Yeah.
Mutual Admiration
It's
Society.
a club that we love. Thank you very much.
Okay.
Bye.
Bye-bye.